So I have been asked, can a chiropractor fix a herniated disc? Which is quite a loaded question. So let's start with what a herniated disc is, okay? So in the spine, there are all these little bones that join together, right? And it's called a three-joint complex. So you've got the big bit of the spine, and then you've got two little bits that allow the movement called the facet joints. So in the big bit with the bodies, there's a little bit like little fluid-filled kind of sac things, and they are surrounded by sort of like a coil of, like, think of it as paper. So that coil of paper can rip, and sometimes that little fluid-filled thing can seep out. So depending on how bad that is what we sort of can then call it. So there's herniated disc, there's sequestered, there's a whole bunch of different things which you can easily Google and would be much better explained on the internet than what I'm trying to do here. But can chiropractic fix a herniated disc? Well, we need to sort of pedal back and think about what caused that herniated disc. And again, there is a very long list of why people have herniated discs. So about 1 in 3 people are walking around with a herniated disc. That's a lot of people, but not everyone is in masses of pain. It really has to do with an entirely huge list of factors of how you are going to deal with this pain. So I've seen people with very, very, very bad disc injuries that have MRIs that are horrible and who are walking around completely fine. And I've seen people with teeny tiny disc injuries who are in masses of pain. So there's no real knowing of how you personally are going to handle a disc. There's no real knowing of how you personally got a herniated disc. And so therefore, there's no real way of knowing of how your body is going to be able to fix your herniated disc. And then you've got to think about the fact that you may not even need to fix a herniated disc if you are totally fine and there's no damage and it's not changing your daily life. So I believe that chiropractic doesn't fix anything. I believe that your body will fix what it needs to. Again, I believe we have outsourced our health to other people, and so we are constantly looking for somebody else to fix us. We go to the chiropractor saying, can you fix my herniated disc? We go to the GP saying, can you fix my herniated disc? We go to the pharmacist and ask them the same thing. But the truth is that nobody can fix your herniated disc. The truth is that the body will fix the herniated disc if need be. But we also need to go back and think about why you have a herniated disc. What's the point of fixing a herniated disc if the reason you have a herniated disc is because you sit at a computer for 13 hours a day? And if you fix your disc and then go back to sitting at the computer for 13 hours a day, what do you think is going to happen? So fixing something is a really big concept that needs to be unpacked.